inform the people from outside to please come to the plenary hall to join the plenary session. May I request? Uh, Before we begin the session, I have this privilege to introduce the dignitaries on the dais. The plenary session, as you know, will be focusing on national perspective on disaster risk reduction, Sandai and beyond. As our Honorable Union Minister has told, the Government of India has taken a great initiative by preparing a national disaster management plan following the Sandai framework for disaster risk reduction. And this meeting, the second meeting of National Platform on DRR, disaster risk reduction, is the follow-up actions for all stakeholders to come together and take initiatives for reducing risk and enhancing resilience. And in this chair, we will be discussing, and Dr. Thirupuggazh, who will be the panel expert in this session, will be focusing on this. So I would introduce first the chair. Dr. P.K. Mishra is additional principal secretary to the Prime Minister, but before joining the Prime Minister's office, he was working for Government of Gujarat, and he was Chief Executive Officer of Gujarat State Disaster Management Authority, wherein he has contributed a lot after the Gujarat earthquake. He had published his experiences in the book, The Kutch Earthquake 2001, on recollections, lessons and insights in the year 2005. And he was also member of International Advisory Group of the World Bank to prepare a disaster recovery framework at the global level. He has done a lot of contributions and is very famous for his works related to reconstruction and recovery after the Gujarat earthquake. There will be not any words worth enough to describe and appreciate about him, his works that he has done related to disaster risk reduction and resilience. So I will not elaborate on his contributions, but only that he is very much a major contributor in the developments in disaster risk reduction at the state, as in the Gujarat, as well as at the national level, being additional principal secretary looking after disaster management activities from PMO. Thank you very much, sir, for accepting our request to be the chair of this session. The co-chair for the session is Shri Kamal Kishore ji, who is member National Disaster Management Authority, as another famous personality in the field of disaster management, who had worked for UNDP, United Nations Development Program project at several places, and he was in Delhi, Geneva and New York, and worked at the global as well as the regional level for disaster risk reduction, not only disaster risk reduction, but also sustainable development and recovery projects at the global levels from the United Nations side. Currently, he is the member from National Disaster Management Authority, and basically professionally he is a architect. And the panelist with us today on this session is Dr. V.Thirupuggazh, who is Joint Secretary, Policy and Planning at National Disaster Management Authority. He is an officer of Indian Administrative Services, who was also CEO at GSDMA in Gujarat before joining NDMA as Joint Secretary. He is also recently completed a tenure as Senior Advisor, National Reconstruction Authority in Nepal after the Nepal earthquake on 25th April 2005. I welcome all the dignitaries on the dais and request the chair to please conduct the session now.
Good morning to you all. Good morning to you all. There are two panelists here. Of course, Sri Kamal Kishore is not only the panelist, but the co-chair, and a presentation will be made by Sri Thirupuggazh. Both of them are, as Professor Suryaprakash mentioned, experts in the field. And it is significant particularly that this is probably one of the most important sessions of this 2 days conference. It will set the tone for the entire conference, for the technical sessions and other sessions. The theme is that national perspective on disaster risk reduction, Sendai and beyond. As all of us know that we have done a great deal in managing disaster, in improving the systems. When I talk about system, I mean the legal framework, policy framework, institutional structure. A lot of things have happened during the last 2 decades, particularly after the Odisha super cyclone of, as Honorable Home Minister mentioned, of 1999 Gujarat earthquake and the Asian tsunami of 2004. But still we have a long way to go, because it is, all these studies show that the frequency and intensity of disaster has been increasing in recent times. Some of our recent initiatives, as again it was mentioned in detail, and I will not go into the detailed aspect about our recent initiatives like the Asian Ministerial Conference of November, that was the first regional conference at the ministers level after the Sendai framework, and also aligning our national plan, the first national plan, with the Sendai framework. All these shows our national commitment to disaster risk reduction. And when I talk about disaster risk reduction, because the focus has been shifting from time to time. In fact, the other day I was looking at a write-up prepared by Professor Bhandari, who is very much here on the 3rd row. He has analyzed how all our framework during the last 2-3 decades, starting from the IDNDR, International Decade for Disaster Risk Reduction, 1990 to 2000. Then we had the Yokohama Declaration of 1994, Hyogo Framework of Action, 2005 to 15. All these have brought out the approach to disaster management at the international level and national level. For example, in the 90s, the focus shifted from a relief-centric approach to that focusing on prevention, mitigation, and preparedness. I think after that we focused our attention more on mitigation, though there were mitigation activities even much earlier, but more attention was paid to mitigation, preparedness, and preventive methods. After that, the Hyogo framework talked about disaster resilient countries, areas, efforts, and activities. Now the Sendai framework talks about, earlier we talked about reducing disaster risk. At some point we moved from disaster management to disaster risk reduction. And what is risk, what is hazard, and all that are well known to all the professionals, and probably the presentation also will bring out. Hyogo framework talked about reducing disaster risk, but Sendai framework tries to go much beyond, talks about even quantifying some of these activities, how the reduction could be quantified, whether some targets can be. All these, of course, will come part of the presentation. So what we are discussing today is that our national efforts and in our efforts not only at the national level but also at the state level, district level, sub-district level and local level, how we can make all our activities, our framework much more effective, much more realistic, keeping in view our own situation and also the Sendai framework. And the Sendai framework itself, one can say that why Sendai framework? It is only because we are also not only part of the whole effort, but also it includes some of our own ideas and initiatives also. For example, at some point about 4 or 5 years ago, there was some study or some details were to be collected about our performance and progress in the context of the Hyogo framework. So that time I tried to look at what has been done in the context of Hyogo framework. Means Hyogo declaration was in 2005. After that, and I looked at the Gujarat data which was readily available. We found that many things have been done in different areas of disaster risk reduction, but several of those started not in 2005 but before, 2-3 years before, after the 2001 earthquake. So it is not that many of the activities we have taken up in Gujarat, Odisha, Maharashtra or any other state or the national level may not necessarily be because of the Hyogo framework, but some of those may predate the Hyogo framework. Some of them may be simultaneously taken up, but a framework provides some sort of a working environment, some sort of a vision, some sort of a operational framework. So it is in this sense that Sendai framework can also be relevant and useful, though one can always question why Sendai framework, why not our own framework. Somebody can also say that what is so new about Sendai framework? We have been talking about some of those for quite some time. But when Dr. Thirupuggazh goes into the details, we'll see what are the changes which have come compared to the earlier framework based on our experience and based on some of the ideas. And it provides us a benchmark not only about our own ideas but also thinking at the global level. To that extent, it is relevant. In this context, I would also like to make a mention, as Honorable Home Minister also mentioned, that Prime Minister had mentioned about 10 action points in the AMC-DRR. So they are also extremely relevant. Some of those, of course, again will overlap with the Sendai framework, our own national plan. So keeping all these ideas together, we have 1 hour, we can discuss how to go ahead, how to achieve the objectives put forward in the Sendai framework, our own national plan, and all these efforts can enable us to achieve our objective of disaster risk reduction in a much more coherent and much more effective way. With these introductory remarks, I would now stop here, and the structure will be that we have actually total we had 1 hour, now we have about 40-45 minutes. The presentation by Dr. Thirupuggazh will be for about 25 to 30 minutes, and then we'll have some time, about 20-25 minutes for questions, queries and discussion from the participants. So may I now request Dr. Thirupuggazh to make his presentation.
if you love your children, there will not be any war. Famously said J. Krishnamurti, the world teacher and philosopher. If J. Krishnamurti had spoken on disasters instead of wars, he would have said the same thing. He would have said, if you love your children, there will not be any disaster. If we love our children, grandchildren, and great-grandchildren, we will not allow any hazard to turn into a disaster. We would not want them to be buried under debris in earthquakes. We would not want them to be washed away in floods. We would not want them to be roasted alive in chemical and industrial disasters. We would not wait for international frameworks or ministerial conferences or platforms. We would act now. The purpose of this two-day NPDRR is to enable such an action. The purpose is to see and act. Seeing is understanding. We don't say, oh, I understand. We say, oh, I see. Seeing is understanding, and understanding should lead to action. In order to act now, we have to understand three things. One is, what is the risk? Second is, what we have done vis-a-vis what needs to be done and where is the gap? And third is, planning and acting to bridge this gap. India is one of the most hazard-prone countries in the world. It is ranked third in hydrometeorological hazards, and it figures among the top 10 countries in terms of number of people affected in the recent past, continuously in the recent past. So, I am not going to describe in detail the hazard profile of this country, how many kilometers of the coastline is prone to cyclones, what percentage of the land mass is actually prone to earthquakes, or how many hectares of land is affected by floods. I am sure over these 2 days, you will see this in a number of presentations. Instead, I would focus on the impact of this hazard and risk in our country. If we take this 10-year period from 2005 to 2014, which is the baseline period mentioned in the Sendai Framework of Action, 23,840 people died. We must remember that in this decade, we did not have any major earthquakes or tsunamis, which means disasters which strike without any warning. Second is, 13 crore people were affected, nearly 1/10 of the total population of this country. Total economic loss is 282 lakh crores, which means nearly 28,000 crores every year on an average. Lot of initiatives have been undertaken at the international level for reducing risk. We started with International Decade for Disaster Risk Reduction, moved to Yokohama Declaration, then Hyogo Framework of Action, and finally now Sendai Framework of Action. We started with better response, then reducing losses, moved to disaster risk management. Now we are talking about disaster risk reduction. In the same year in which Sendai Framework was declared, Sustainable Development Goals were also adopted, and Paris Agreement was also signed. In fact, these two, Sustainable Development Goal document as well as Paris Agreement, precisely talk about disaster risk reduction. 4 of the 17 goals of Sustainable Development Goals talk explicitly about disaster risk reduction. And rest of the goals, like improving access to health, education, sanitation, drinking water, all these are in a way vulnerability reduction. Paris Agreement is totally about disaster risk reduction. Whatever may be the cause of climate change and whatever may be the effect of climate change, it is going to result in disasters. Whether it is sea level rise or extreme climates resulting in droughts or floods, ultimately it is going to result in a disaster. So climate change risk reduction is, in a sense, disaster risk reduction. Influenced by international thinking and learning from our own experiences, we have also moved from post-disaster relief to holistic disaster mitigation and prevention. We have come a long way from relief manuals to comprehensive disaster management plans which include prevention and mitigation. We have our policy instruments in place, we have our act, we have our policy and a national plan, very well appreciated national plan. We have our institutions in place at the national level, state level and district level. We have national level institutions in the form of National Disaster Management Authority, NIDM, National Disaster Response Force. We also have SDMAs and DDMAs and state disaster response forces. Our early warning capabilities have greatly improved, as we have seen in the case of Phylin and Hudhud. Our response capabilities have also greatly improved. National Disaster Response Force is considered to be the largest dedicated force in the entire world for a disaster response. We have done very well in the field of response. Now, the question is, how do we manage risk reduction? How do we mitigate and reduce the risk of disasters? That is the question. This NPDRR is to create a roadmap for reducing disaster risk based on the 4 priorities of Sendai framework. These 4 priorities are understanding risk, improving risk governance, investing in risk reduction, and the 4th is improving recovery and building back better and better response. These 4 priorities are not arranged in time sequence. It is not that we understand risk first and then improve our risk governance, then we will reduce our risk. Finally, if things are out of control, we will launch recovery programs and relief. No, they are parallel processes. Even to understand risk, you have to conduct a lot of studies, seismic microzonation, or preparation of a hazard risk vulnerability atlas. All these need investment. To complete these studies, you need good governance, good disaster risk governance. So all these 4 priorities are interrelated priorities. In addition to discussing this roadmap, aligning it with the 4 priorities, we have to also align it with the 10-point agenda of Honorable Prime Minister. You must have noticed that every speaker who spoke in the morning session spoke about PM's 10-point agenda. This 10-point agenda is not very different from the 4 priorities identified in the Sendai framework. It is in fact 10 action points culled out from the 4 priorities. I will quickly run through these 4 priorities: risk coverage for all, leadership of women, investing in risk mapping, leveraging technology, networking of universities, using social media for effective IEC, building on local capacities, learning from disasters, and creating greater cohesion in international response. Before we create a roadmap for action, we should understand the roadmap or blueprint we have for inaction. This blueprint is not only for India. This is a universal blueprint which prevents action. What is this blueprint? First is, make the problem uncertain. Say that disasters are uncertain. We don't know whether they will occur or not, when they will occur, what will be the magnitude, how can we plan for it, how can we stop our development for an uncertain event which may occur or which may not occur. There is exactly an opposite argument which is for inaction. That is, make the problem which cannot be avoided. Say that this problem cannot be avoided. So if something is not avoidable, then what can we do? We will prepare for response and recovery. I've seen this statement coming not only from laymen, from educated people, from media people, and also people who are disaster managers. They say that disasters cannot be avoided, but their impacts can be reduced. We must work towards it. The moment we accept that they cannot be avoided, then the mindset will change. We will not work towards prevention and mitigation. The third is, make the solution seem expensive. Say that it is not possible. How can we prepare for a 200-year flood? How can we prepare for a 500-year earthquake? It is not possible. This notion of expensive is not based on real calculations, not based on any cost-benefit analysis, but this notion is there to prevent action towards risk reduction. Then we can make it as an all or none issue. We say, yes, disasters are real, they may occur, the risk is there, but the problem is so big, we have to address everything. We cannot address everything, so we need not address anything. I will give you a simple example. If there are 4 million buildings in a particular city which are not disaster resistant, then we can take an approach. It is impossible to retrofit 4 million buildings. What can be done about it? But instead, we could apply a 80-20 rule. If we prioritize, select 20% of the buildings in terms of their importance, in terms of the functional importance, in terms of the public good involved in it, then we can reduce 80% of the losses. We can save 80% of the lives. Instead, we can easily adopt this all or none issue. Then make it feel that it is a policy issue or an issue of act. Unless you have a policy, unless you have an act, how can I work towards disaster risk reduction? Make it an issue of policy and wait endlessly for a better policy to come. Finally, wait for perfection. One can always say the disaster management plan is not perfect. Let's create a perfect plan and then we will act upon it. Then waiting itself will become an obsession. I am remembered of several buckets waiting for Godot. The two tramps wait endlessly for Godot. They keep on waiting to such an extent that they don't want Godot really to appear. If Godot really appears, what will happen to the waiting? They have invested so much in the waiting. So we keep on processing, we keep on refining the plan and never want to act. A perfect plan will never lead to perfect implementation. It can be the other way. Perfect implementation can tell us some lessons. Taking those lessons, we can improve the plan, we can perfect the plan. So the first thing is we have to discard this blueprint for inaction. The second is we have to align our roadmap along with the 4 priorities. First is understanding risk. This picture tells all. We are not a risk-sensitive society. I don't need to describe this slide. Educated, rich, urban elite, uneducated, rural people, all are insensitive to risk. Why is it so? See, there are 4 types of risk. First, we have to understand this. First is called objective risk. Objective risk is the way experts understand risk. They talk about assessments, studies, microzonation, and all those things. The way experts understand risk. But the way experts understand risk is not going to bring about a transformation. It will not result in risk reduction because people understand risk differently. That is called a subjective risk. For a common man, traveling in air is more risky than traveling on road. But all studies say that traveling on road is more risky. Recently, I was looking at a document which says that the risk of meeting with an accident in air travel is 1 is to 1,35,000, whereas the risk of meeting with an accident while you are traveling in a car is 1 is to 6,000. That is experts' point of view. But people think, even in America, flying is more dangerous. Unless we change the risk perception of people, we will not be able to reduce risk. Then there is something called a desired risk. It is not that people really want to avoid risk. All the risk people want to. They are willingly ready to embrace a certain amount of risk. What about people who buy sea-viewing apartments, sea-facing flats, sea-facing bungalows, mountain view apartments? They are willing to embrace risk. And fourth important thing is there is something called acceptable risk. If you want to reduce risk, we have to understand and arrive at a conclusion or a consensus what is the level of acceptable risk. This level of acceptable risk differs from country to country. In a developed country, the level of acceptable risk is low. In an underdeveloped country or a least developed country, the level of acceptable risk is high. The level of acceptable risk depends on social, economic, and even political factors. In a dictatorial regime, the level of acceptance of risk is very high. In a democratic country, it may be very low. And finally, when people are facing everyday risk, it is not right on our part that they will think about long-term risk. How are we going to convince people about the long-term risk? It is not that it is not possible. It is possible. Some of the countries have done it. Japan has done it. Every household has been given hazard risk vulnerability map of that particular household. They have been convinced to undertake retrofitting measures. It is part of the school education. Drills are regularly conducted. It is possible, but we have to educate people. I will tell you something from my own experience. After the occurrence of the Gujarat earthquake, after 5 months, earthquake in Gujarat occurred in the month of January. In May, I visited a village in Bachau, which was more or less totally devastated. One NGO had adopted this village, and this NGO was supposed to construct all the houses. They had brought truck loads of cement and bricks, and they have kept in the village. These bricks were lying on the road. On the first day,